On May 11, 2023, the public health emergency will be terminated. This emergency declaration helped healthcare providers continue operations during the COVID-19 pandemic. So the question becomes, what happens after PHE ends? The Biden administration decided to end the PHE because it believes that the pandemic is now more manageable. Widespread vaccination and federal efforts have allowed the country to transition away from an emergency phase. Still, there's a great deal of uncertainty about the implications of this move for long-term care facility operations and resident care. Here we'll discuss 7 big changes teams will need to account for after the termination of the PHE. Number 1. Immunity shields or liability shields will no longer be in place. These shields protected long-term care facilities from COVID-19 related legal liabilities such as deaths, injuries, and criminal liability related to the virus. Now, facilities will not receive this protection, leaving them more vulnerable to lawsuits. Number 2. The Medicare 3-day rule will return. Patients must again first be admitted in a hospital for 3 days or more to qualify for Medicare Part A coverage in a skilled nursing facility setting. Number 3. Medicare recipients will now have to contribute towards some of the costs for COVID tests and treatment as well as telehealth services, which became far more prominent during the pandemic. This is because these services will not be paid for by Medicare after December 31st, 2024. Number 4. Under the PHE, Medicare waived several staffing and training rules for nursing aides. This waiver was terminated in June 2022. But nursing aides were given an additional 4 months to complete their training and certification after PHE ends, allowing them to continue working in nursing homes. After that, though, such waivers will cease to exist. Number 5. Home health and hospice must resume services that were previously dropped, including volunteer visits and occupational, speech, and physical therapy. Number 6. Medicaid, which had been made more accessible through additional provisions and funding during the pandemic, will have stricter rules again, and states will have the power to drop Medicaid enrollees who fail to meet eligibility requirements. Number 7. States will lose some flexibility for home-based initiatives. This means that some Medicaid recipients who are entitled to long-term care nursing homes will no longer have this option. With the end of the PHE, there will undoubtedly be a period of change and transition in long-term care facilities. Healthcare providers will need time to retrain their staff for the new normal, but there is hope that the public health emergency may be extended again. Only time will tell. For more insights on the long-term care industry, go to experience.care/blog.